So how does this work? So if you think back to your hand rotation or back to medical school, what were the important parts of a nerve? And if someone has a transected wrist, spaghetti wrist, when we were on call on the hand rotation, what did we do? And so what we did was we sutured the perineurium, the epineurium together, right? We didn't take the individual axons when you're on call at 2 a.m. trying to put this back together. We didn't take individual axons and stick them together, right? What we did was we took the 8-O-proline or whatever it was, and we sutured the epineurium to allow the highway to essentially be reconnected. And so what's important here is the epineurium, the perineurium, and endoneurium, the coating of the nerve in order to enable the axon to regrow, because after you freeze it, we want that nerve to regrow. And so it's important that we maintain that highway. And that's what we see with iovera, is that highway is maintained at this temperature. The axon goes away, but the epineurium, the endoneurium, and perineurium are completely maintained. And we appreciate that because, like I said, when we fix transected nerves, that's the anatomy that we try to restore. So if we can maintain that anatomy, then that axon regrows along the original path that it was on. So when we look at the different ways of injuring nerves, we use the Sunderland nerve injury classification. So let's start at the bottom here and work our way up. 5th degree nerve injury, transection, which most of us can appreciate. The reversibility of this is non-existent, right? We've got 3rd or 4th degree damage or nerve injury. This is neurotmesis. And this is what we saw with liquid nitrogen. So this is when things get extremely cold, minus 140 degrees. You ablate the tissue, you essentially damage the tissue, and you can't reverse that damage or that injury. Now, when we talk about reversible nerve injury, 2nd degree reversible nerve injury is called axonotmesis, and this is where iovera lives. So at this temperature, at minus 88, that nerve is able to regrow along the original path. And so we stay within the 2nd degree nerve injury zone. And then 1st degree neuropraxia stingers that we see if you're covering football games or what have you. This is basically the most basic nerve injury that we see. So one of the big issues is understanding all the different technologies that are out there and distinguishing technologies that burn the tissue or destroy the tissue versus technologies that cool the tissue or freeze the tissue. And so I created this pictorial here because the nomenclature and the marketing around this can get very confusing. And so when we look at pulsed RF, so radiofrequency ablation, what we're doing is actually burning and destroying the tissue. So when we look at typical radiofrequency ablation, you can see where it lives on the temperature spectrum here. When we look at cooled RF, okay, cooled RF or COOLIEF, it is still burning the tissue. And the reason they use the term cool, C-O-O-L, is because they drip a little bit of saline at the end of the needle to try to cool the tip off a little bit to create a larger size lesion. So the burning version of an ice ball, if you will. And so don't get confused and don't get tricked by the nomenclature here. There's nothing cool about cooled RF. It's burning the tissues and permanently destroying them. You may hear about pulsed radiofrequency ablation that lives at about 40 degrees Celsius. Obviously, body temperature is at 37 degrees Celsius. And you can see where iovera fits. It's at minus 88 degrees Celsius. And then liquid nitrogen cryoablation is what you see down here. So I want you to take a minute and understand this slide so you understand when you see these different technologies that are out there, you know exactly what you're talking about. And so cooled RF is really burning tissues at 80 degrees Celsius. Iovera is almost the exact opposite. It's freezing tissues at minus 88 degrees Celsius. And so I'm happy to answer questions about that a little later. So this is kind of a pictorial of how this works. So here's the axon. We're going to freeze it right here. It's going to go away, and then it's slowly going to reinnervate and regrow along the original path that axon was on. Why? Because we maintained the epineurium, the endoneurium, and the perineurium, and only the axon itself disappeared.